Now this is a patient desperate for a diagnosis, and in this there is a patient, Miss Colin. She is having 4-year history of lethargy, muscle ache, joint ache, headaches, and prone to recurrent infections, abdominal pain, and dysmenorrhea. She has been treated for the endometriosis as well, and but she thinks that since endometriosis, her symptoms have worsened, and she is evaluated by a number of specialists, but all tests came out to be normal and no one was able to find out any cause. So GP now has referred to you and thinking the diagnosis of chronic fatigue syndrome. So your task is to explain the Miss Colin the likely diagnosis of chronic fatigue syndrome and address any concern she has. Now in this skill, you have to, the patient is suffering for a long time, and number of tests has been done, she has been evaluated by a number of doctors, number of specialists, and up till now the patient is suffering and she's not being improved, and so she's very much upset, irritable, and she has lost trust in the doctors. So in this skill you have to try to take her trust, as well as show lot of empathies and concerns and appreciations, and feel her sufferings as she has been evaluated, how many tests have been done, how many times the specialists have seen her. So like this you have to carry out this skill, and so now we will do it. As in every skill, we are doing introduction, greet, understanding, purpose, agenda. So hello, good morning. I am Dr. Reis, one of the doctor in the medical clinic. Are you Miss Colin? Okay, nice to meet you, ma'am. Well, I understand that you are having weakness and some pains in the body, and you went to the GP. You went to the GP as well. Is that correct? Okay. So I'm here to discuss with you about the possible diagnosis and what we can do further. Okay? Okay. So before I proceed further, will you tell me that how you feeling now? Now she will tell you about all her story, all about her problems like muscle ache, joint ache, tiredness, and how many times she has been evaluated, how many times her tests have been done, but still no output. Now listen all, adopt the golden silence and listen all with full concern, okay, so that she gets idea that you are concerned with her, and keep on saying that phrases, show genuine concern, empathy, and keep on saying that I can appreciate how this has really affected your life. I can understand, I can understand your situation. It must be very upsetting for you if you have difficulty getting out of your house, and like this, and I can acknowledge that it is very frustrating to still not have been any satisfactory diagnosis. Okay, so it will help to gain the confidence of the patient, and then tell her that okay, I have seen all the investigations, and these are good news that all investigations came out to be a normal, and also explain that now you can take little history, or as you can say that as I have seen the history, and there is no any cause, I could not find any reversible cause which requires treatment. Okay, so now me and GP, we are leaning towards a diagnosis of chronic fatigue syndrome. Now silence. Now you have to do this scenario from here onward like breaking the bad news, okay, as we have done before. And now see the response, and now have you then take her insight. Okay, have you ever heard of it? Okay, do you want me to tell you about it? And see the responses. The responses can be of 5 types, which I have already explained, and you have to manage each response accordingly in the whatever your patient is showing. And yeah, then you can keep on explaining the chronic fatigue syndrome, that it is a disease. She may ask what causes it, how I got it, what is it, how you will manage. So you have to now answer all of these questions. Now tell that the exact cause is not known for your disease, but the possibilities could include any bug infection or sometimes it runs in family, and sometimes any recent serious sad incident of the life can cause it. And I can give you a chronic fatigue syndrome questionnaire. On that all questions are written about it, and if you can fill it, then we will know how severe is your disease. And tell her that chronic fatigue syndrome, it's a disease in which patients can have long term tiredness and other symptoms such as muscle pain, joint pain, poor sleep pattern, poor memory, unable to concentrate, and they may all exist to a variable degree. Okay, and now if she asks how you will manage me, then or is it treatable, or will I get better, then be honest and tell her that there is no easy treatment to cure chronic fatigue syndrome completely, but there are various interventions which is helpful for to improve the patient's quality of life as well as her symptoms. Okay, and now their examiner may ask you, like you can tell the examiner as graded exercise therapy and clinical psychological management with the CBT, adapting daily activities with the help of the occupational therapist. And now to the patient you have to tell, these are all jargons, okay, tell in the layman language, like we may ask you to adopt some exercises for in your daily routine. This I explained graded exercise therapy. Okay, and some we may ask you to adopt some behavioral therapy as well. We may advise you some behavioral therapy. This I have explained clinical psychological management with CBT, and also adopting some other daily activities with the help of occupational therapist. Okay, so you can answer some of her more questions if she has, and do the injury recap, patient recap of her sports health follow-ups. Please like, share and subscribe my YouTube channel for more videos. Thank you.